Hi. We're going to talk today about something we all do, hopefully every day, or at least on a regular basis, that might make people say, ooh, are we really going there? Yes, we are. Today, we're going to talk about the perfect bowel movement, which in our house we refer to as commonly as poop. So you might hear me slip and say that. But I've invited a guest today that I have so much respect for, Terri Barr. So Terri, thank you so much for coming in. I love that when I asked you what you really wanted to talk about, you didn't even hesitate. A lot of people go home and they mull on it, but she said, oh, I want to discuss the perfect bowel movement. And I said, oh, we have to. So Terri, before we jump into that, tell us a little bit about you.
Well, I could be considered somebody who's been there, done that, and got the T-shirt on many healthcare job and roles. I started out as a candy striper, and I was a tech.
Oh, wow.
I was an LPN, then went to the Bridge program and worked at the hospital for about 25 years in multiple roles, not only on the floor, but supervision, ICU, and the emergency room. Then at the tender age of 40-something, I went back to school and became a nurse practitioner.
I can't even imagine doing that at 40-something.
Right. Well, I was working on the floor again and thought I cannot possibly do this for the rest of my life. It was, certainly a lot physical. And I'd always wanted to go back to school, but because I had a lot of children and other health issues, that just kept getting pushed back. So I became a nurse practitioner and been working with geriatric care for about 15 years and love it.
And that
love that population.
That is where I've met you, and you seem to be everywhere in that population, just doing great things. And I've spoken with so many of your patients, and they just really love having you as their provider. So I'm really honored that you're here. But today we're going to talk about poop.
Yes, because, it's funny. One of my very first rotations in nurse practitioner school was with a digestive disease group.
Okay.
And even, it was a great practice, and but I just didn't see myself doing that, as a full-time gig. Mm-hmm. But I realized that it was so valuable because every one of my patients have, a digestive system.
Yeah.
And for so many, especially the elderly, it doesn't always work the way they want it to work. In fact, I would think that that's a common, if not, problem with most elders that, that system isn't working as it should. So I deal with that all the time. When we were talking about doing this, I thought of an old joke that kind of illustrates how important this is. Because all the parts of the body got together, and we're trying to decide who should be in charge. So the brain said, well, obviously I should be in charge because I'm an intellect and I'm the smartest. And the heart said, well, I should be in charge because I'm the pump that sends everything everywhere. And the eyes said, well, I'm the window to the soul. And then the legs said, well, I take them everywhere. And then the rectum said, I think I should be in charge. And before he had a chance to explain why, everybody started laughing. Thought that was most ridiculous. So the rectum became angry and upset and decided not to work anymore. And within a couple of days, of course, the mind couldn't think, the heart and the legs felt weak, And so, the punchline, of course, is you don't have to be a brain to be in charge, just fill in the blank. But it does illustrate, though, that how important for day-to-day function and for enjoying what you want to do, that system has to work.
Absolutely. And it's because you brought this up now, I'm like studying all the things and watching YouTubes and other things on it. It's such a complicated system. Really, our digestive system starts to work the second you put food in your mouth and your saliva. I thought it had to do more with the chewing. It's actually the saliva that also has a lot to do with it. So there's a whole lot going on in the body to create that perfect or imperfect poop.
Right. And I would say, humans are often one way or another. Either you're kind of a tight personality or you're a little loosey-goosey person. And that, ends up being, shows also how your digestive system will be.
Oh, that's interesting.
Yeah, so some people are either one way or another, and it can be a lifelong issue that they deal with, but often with even seniors, they may have had no problem with digestion, and now all of a sudden they do, and we have to figure out why. Is it, the change in diet? Is it some medications they're on? Lack of activity, fluids? There's a lot of reasons why it can change, and then I try to figure out what to do besides adding one more pill.
Right. Yes, because we got so many pills.
And it's funny how many seniors, when I start going over the basics of digestion and what kind of food you're eating, that they don't seem to be familiar with any of that baseline knowledge. So as a healthcare provider, maybe if I hadn't had all that baseline job, I might pull out my prescription pad and start there, but it doesn't really fix the problem. And, and I can maybe turn things around better by starting with looking at their medications. Some medications are going to cause constipation just naturally. Some medications make things loosey,
Okay.
sertraline, Aricept, what else? I was thinking about, metformin. They're kind of infamous for contributing to loose stools.
And Aricept is often given to those living with dementia, right?
Correct.
So I'm thinking about someone right now that is a struggle. And I am thinking, you just made something go off in my head. So there's all kinds of things. My grandparents, their only response if there was an issue was to drink prune juice.
Not a bad option, actually, but, because it does have benefits, and it's gentler than if you were to take a stool softener.
Gotcha.
If we start with food, it's gentler on the system. And of course, as we add medications, they have maybe an all or none effect, which may be more than somebody wants. You think about I don't know if you've ever taken a laxative. Occasionally you have to do it for pre-op or something, and most people say, "Whoa, that was way too much." Well, if you start doing that on a regular basis, a lot of my patients too, because they're in an assisted living facility. They can't do, the PRN or as needed doesn't happen as much. You try to do, something that's more scheduled, and you can overshoot the mark even. So if we, make adjustments with food, I even draw sometimes a continuum, if you're too loose, not enough.
Right.
What kind of foods to eat.
There's even a chart. I saw a chart and I took a screenshot of it, and it shows very clearly, like if it's pebbly poop, you might be struggling with constipation. If it's a sausage-like smooth poop, that's a normal. And so there are some charts out there that you can look at if you're so inclined. And then there are things that you can do. I'm very, very convinced that our diet has so much to do with the struggles that a lot of people are having.
Absolutely. Yes. I often ask even, like, what did you have for breakfast? Let's start with that, because I think that can be the baseline for a good day. So a lot of people, when they're working, they may have like oatmeal, cereal, and then they retire and they start having eggs, bacon, pancakes, and then they go, wow, things aren't working as well. Well, it's like way too much in the mornings. If you think about yourself, I don't know what you eat for breakfast, but I have like pretty much the same thing every day. But when I'm on vacation and I have a big brunch, I'm not hungry by lunchtime. And usually my stomach, because it's not digested yet.
Right.
Sometimes eggs can be very difficult to digest for people. And yet it seems like such a good idea. I'm having a good breakfast. But then I'll tell them, okay, well, at least every other day, switch to something like oatmeal or Cheerios. See if you can, unburden your GI system and see if that helps. Certainly processed foods, if we're talking about the loosey-goosey side, all that, those extra ingredients.
So much. Even in the yogurts and the things that are, supposed to be super healthy, I see an awful lot of processed ingredients in there.
Right.
And I didn't know that eggs were hard to process, but I definitely know that, like bacon, for example, I've read somewhere that the cells of bacon and the cells in pork and beef are larger and they're harder for the body to digest. I don't know if you know anything about that, but so we've actually in our family tried to cut back on that so that we're having beef or pork once a week and not on a daily basis anymore.
Absolutely. Yeah, and I even think, things like pancakes, if people are prone to being constipated, pancakes kind of expand in your belly, slow things
Didn't
down.
know that.
Bagels are notorious for constipation, So as I said, it's, by getting just that information, even patients that will take something like Miralax every day, I say, well, why don't you put that in your coffee? A hot drink will stimulate, your bowels better than a cold drink will. That'll kind of slow things down. So, what you eat the first thing is helpful. You need to have enough water during the day. You need to move. Your body's not going to be efficient if it's sitting all the time. Just moving can start that. And then I also tell them, and when the spirit strikes, by all means, take advantage of it. Think about yourself. If you're at work, you're definitely not going to be, taking the time for that. But for anyone that says no, now's not a good time, that sends a signal to your brain to stop and slow things down, and then the system begins to back up.
Right. And you mentioned drinking fluids, drinking water. How much do you recommend? Because I try to do half my body weight in ounces. And my husband says, no, you should only do, what you're led to drink. But I'm on the road a lot. So I'm actually not as led to drink during the day because I don't want to have to stop and use the bathroom all the time.
Right.
So I make it a goal to drink half my body weight in ounces every day. But is that what you recommend for a senior who may not be as active anymore?
No, and we have to be really careful with fluids with seniors. There's a lot of other things that can be an issue if they have congestive heart failure.
Right.
But some women who, because of years of trying to keep their weight down and used water as a way of filling themselves up, sometimes as they age, their kidneys aren't concentrating the urine, and they end up having like low sodium content, low sodium in their blood because it's being diluted with all the fluid that they're. So for them, mostly I say, yes, drink more. But I think that most people could drink more, and most people don't drink any water. I mean, so if I could get them to double the, okay, we'll have, 3 large glasses because you're not doing any,
Right.
Let's start there. If I tell them, half your body weight, they're like, I don't think that's going to happen. And with women who get older and become, have a little problem with incontinence, they're the hardest to convince because all they can think about is, if I drink this water, I got to go to the bathroom again.
Yes. Oh, yes. And that's why
I laugh
set
and
a goal.
I'll say, yes, it's a full-time job, I know. But if if you have any type of difficulty even getting up,
right,
you're like, I'm not drinking all that because I can't get up and go.
Yes.
So just trying to get them to increase it is, but whatever they're at, most people at that point need to drink more. Occasionally, we've got somebody who I might have to say, well, in your case, don't
back down
drink
a
as
little.
much. Yeah, back down, or maybe have a bottle of Gatorade during the day just to help with your electrolytes. But yeah, and we as younger women, we can drink as much water as we care to, and the body will metabolize it. I mean, we may have to go to the bathroom more often, but it's not it's always a good flush, and it's certainly better than sodas.
Yes.
I mean, sodas aren't good for digestion. All that carbonation in your tummy, it can disturb things and make people, feel bad and have everything kind of slow down, or if any of that carbonation gets caught behind someone who's constipated, it can cause abdominal pain that makes them think that they're dying because of that. So,
I found I can't do carbonation really at all. Even those fun little waters that have no calories that I love to, pop the tab and hear the fizz. I can't drink them. And I'm very sad about it because I want to on a hot summer day, but I can't handle the carbonation. And I've wondered about that for others.
Right. And I think you're smart to see that correlation. I have so many patients who, haven't found, every time I do this, this happens. Or when I eat this, this bothers my tummy. And, so I encourage people to even keep a little food log. If you can't, individually see the correlation, write it all down for a while, and I can tell you, okay, well, it looks like every time you have this, you have a tummy ache, or every time you have this, 2 days go by and you haven't had a bowel movement, so, I'm not saying you don't ever get to have that food, but be aware of how it affects you and how you feel after you eat it.
And literally everyone is so different. I mean, my husband has some lactose intolerance issues, but we found that there are some cheeses and some milks like goat's milk and sheep's milk that he can handle, and even Cabot cheese that's processed in a different way he can handle. But some people can't handle even that. So I think one of the important things that I've realized as I get older is it's really important to have a good provider that can help you to kind of walk through these things because, when we're young, I didn't have a primary care provider until probably 5 years ago because I was healthy. I said, who needs that?
Yes.
So, but as you age and your body is really starting to change, you need somebody that you can run these thoughts by, and you shouldn't be afraid to talk about it.
And of course, you have to, as a provider, you have to take the time and see your role more than just prescription writing.
Right.
And that's I don't know how other providers have been educated, but I do feel as an advantage being a nurse for so many years and actually having to deal with that in the hospital or with patients at that level. I'm used to the tricks of the trade.
Yeah. And I found that about nurse practitioners. If you have a great physician, awesome. But I like to make sure that a physician has a nurse practitioner too, because I think they see things a little bit differently, and they do tend to take that time to even discuss, hey, what's the texture of your bowel movement like?
Right. And not be embarrassed. I say it's like reading tea leaves,
It is.
I can tell a lot about what's going on by, either how they describe it or in the facility. I saved it for you, it's like, lovely. But, it does give me information. It helps.
It does. It is like reading the tea leaves. That's a good illustration. I mean, and we're all okay with doing it when we're dealing with a baby, right? But at some point it becomes, around kindergarten, all of that seems funny. I used to teach kindergarten, and there would be a day where a child could come in and pass gas and nobody would respond. And somewhere in about the middle of the year, a child would pass gas and everyone would burst out laughing. So at some point, we get to a place where like, oh, this is funny, this is embarrassing, this shouldn't be talked about. And I just disagree with that.
And yet older people, they don't mind talking about their bowels.
I do remember that with my grandmother. She seemed almost fixated on it toward the end of her life.
And I think it's because it makes such an impact. Can I get up and go? I had, we have, it's along a continuum, but I've had some extreme cases of patients who had diarrhea that, one woman had short gut, so they had taken out a lot of her large intestine.
Right.
Another gal had stomach cancer, and the treatment she was having, that they were having so many bowel movements that they were incapable of leaving their homes and were actually losing weight and becoming dehydrated. The one gal even told me she gets up in the middle of the night to eat because if she doesn't, she's lost weight by the next day. So, these are extremes. Whoa. So at that point, we have to help, at that point, what are we going to do? So, luckily there's a medication called cholestyramine, which was originally for cholesterol, and its big side effect was constipation. So by adding that to their regime, it helped them then go back to living again, to leave their rooms. I mean, wow. I was one lady when she finally agreed to take the medication because she was so afraid of going in the other direction. But like 2 days later, I see her outside coming back from shopping with her husband. She hadn't been out of that building in over 9 months because she couldn't get away, get too far from the toilet. So, or if they don't feel good because they're so constipated, once again, they're not going to go and do the things that they need to do or want to do because this system
shuts you down.
Shuts you down.
Yeah. Oh, yes. So impactful. So is there anything else that you can think of that you just really want to impart on the people that are watching and listening today?
I would say start with the basics, such as food and a review of your meds so that, if there's anything that is, having an effect that can be eliminated or replaced. And then the more of God's foods you can eat and less of man's foods, the better your body's going to feel.
Yeah.
So even when people will say like, well, I shouldn't have an apple because I'm diabetic. Wow, that apple is not as bad as the apple pie and will give you good nutrition and help your digestive system. So, yes.
And another thing, do you suggest eating those things instead of drinking them? Because I know some people
that's a very good point.
The juice instead.
Now so any type of commercialized juice is high in calories and sugar, even orange juice. It'd be better to eat the orange than to drink the juice.
Right.
But I have seen people do juicing where they take a lot of, when I was going through chemotherapy, my husband would juice three carrots and an apple. And because it was such a simple food, it was the only thing that I could get down in the morning, because I was feeling nauseated and upset. So the nutrients are easily released in that juicing process, but that's way different than
buying a juice off the counter.
Exactly. But I think juicing is good, but there may be better ways of getting your nutrition that will get you not only the calories, but also the fiber and, whatever else. The benefit you get from eating the fruit or eating the vegetable.
Yeah, because I'm thinking about back to my college days, and some of us, you're eating college food, so talk about processed. So there were issues, and some of us realized, hey, if we drink a lot of coffee in the morning and we have some apple juice, we can get things going. But now in retrospect, I'm like, oh man. Then talk about adding the freshman 15. That just probably helped to add to that freshman 15.
Yeah, you mentioned the apples. Of course, apples in 3 different forms. Apple juice can actually cause looser things, an apple can. But then we use apple sauce when people have diarrhea.
Yes.
So, somehow that process seems to settle the tummy, whereas the other formats make it go along this way.
I've always wondered about that because the brat diet is applesauce. And I was like, well, if apple juice makes you run the other way, I never understood that. But it's probably has something to do with the process. And you cook it down. So you may be cooking whatever it is out.
Yeah, I think it must be somehow in the process. But yeah, it's different formats. Or you can think... people think about, oatmeal's good, and oatmeal makes things move. Rice cereal will constipate you. If you think about it, when you have a baby.
Yes.
That's what the whole idea of the perfect bowel movement. When I had a child and I was, the oatmeal versus the rice cereal, depending on the most recent bowel movement the child had, So, realizing, that it mattered, what kind of cereal I gave the kid, would make a difference whether or not they, had nice, soft, easily passed stools.
Or not.
Yes.
Yeah. Well, thank you so much for coming and talking about this. This was a really fun topic, and it's one that we're all experiencing, whether you're talking about it or not. And I think it's funny that you mentioned that a lot of times our seniors do talk about it. It is a lot of what's going on in their life today. So, so I appreciate your coming and talking about this.
Well, thank you for asking me to come. I thoroughly enjoyed it.
Yes, me too. So if you haven't liked this podcast yet, and I don't know why you haven't liked it this far in, but I'd appreciate it if you would like it, if you would subscribe to our channel, and if you would share it with others, because, this is a tool. And we have lots of other great podcasts on here, but we did have another one recently that I'll probably try to link to this, where we spoke with a dietitian, Devin. So I will try to link that. And I hope you all have a great day until you see us next time. Thanks again.